Let's talk about some advantages now for using the Breg Kodiak continuous cold therapy machine versus an ice pack. Typically when you use an ice pack or a gel pack, the cold only lasts for 15 to 20 minutes before you have to replace the cold with another gel pack or go and get some more ice. And usually when using those modalities, it's simply it's more of a topical freeze or sensation that is reducing the pain, but it truly doesn't penetrate into the joint and cool down the joint space. Continuous cold therapy is proven through studies that when using a device such as this and circulating cold water for periods up to 3 to 4 hours, it will cool down the joint to which you've just undergone a surgery, and it will significantly reduce the pain in that area. It also helps you to sleep better, to ambulate, and to gain range of motion sooner because you're able to get up and do your therapy sooner with less pain. One other benefit to using a continuous cold therapy device and a result of how it handles pain management is it will significantly reduce your need for pain medications. So the cost benefit for a cold therapy machine is significant. We do need to talk about some contraindications and risk factors pertaining to any cold therapy device that's on the market. Some contraindications might include a history of cold injury or frostbite, patients that are incoherent due to general anesthesia or sedation, compromised local circulation or wound healing, circulatory syndromes, tissue infection, or diabetic polyneuropathy. And those are just contraindications for continuous cold therapy. Risk factors that would not necessarily exclude you from using a cold therapy device would be things such as excessive smoking or tobacco use, medications that have a negative effect on peripheral vascular circulation, or young children and the elderly population. And primarily because we want to make sure that when we're using a continuous cold therapy device that we have good circulation, especially in our extremities, but also that there's no communication barriers. When using any cold therapy device, whether it's the Breg cold therapy, Kodiak, or any others, we want to make sure that when using this, that this pad is not placed directly on the skin, that there's some type of barrier, whether it's web krill or a thin shirt or you're bandaging, something that sits between the pad and the skin so as to protect that skin from any type of cold damage. And that's really why those risk factors are there. We want to make sure that those who are using it are able to communicate well as they're using it to any irritation they might be experiencing while using continuous cold therapy.